assistant professor of pharmacy practice is someone who works for a college of pharmacy in the Department of Pharmacy Practice and has responsibilities in three major areas, which are teaching, service, and research. I've been an assistant professor within the College of Pharmacy at Nova Southeastern University for 3 years. I didn't really expect to get into academia. It just kind of happened. I didn't expect to get into clinical pharmacy. That also just kind of happened. I thought I would be a Walmart pharmacist, which I still kind of want to be someday. So I like working for Walmart as a student. But I met several different mentors throughout my academic career who pushed me towards clinical pharmacy. And I really took their advice because they were successful, and I thought if they were successful, I could also be successful like them. And that led me to do the PGY1 and PGY2. And as a PGY2 resident, I was exposed to some academic experiences with Nova Southeastern University in an elective that they were offering. Through that elective, I was able to interact with more students, and I learned that I really enjoyed working with students. During my residencies, I learned that I liked research, and teaching and research are two of the three core focuses of academia, the third being service. And for me, what my real focus is service related to patient care. Having a practice site at Jackson Memorial Hospital is really cool for me because we see so many different patients from the United States, South America, Central America, Europe, patients with transplant, oncology, lots and lots of different infectious diseases, and that's my specialty. So it's really interesting. A lot of the drugs that you'll see used here may not be used in high frequency at other centers, but since our dynamic patient population, I get to see and get exposure to those patient groups. And in terms of service, which incorporates caring for patients along with other things, that's really interesting for me and really helps me to enjoy my job. When I have students come to my rotation as a P4 or fourth year student on their experiential education, a lot of times they are blown away with some of the things that they get to see here because it's so interesting. You know, anything from someone that gets a shark bite wound and they are exposed to organisms that live in the water, so what drugs do we pick for that? To someone who's bitten by a mosquito that has malaria, and so what drugs do we use for that? And so it's really quite interesting. To step into my current role, I completed a Doctor of Pharmacy degree at Northeastern University in Boston, Massachusetts. Following my graduation in 2008, I did a PGY1, or Postgraduate Year 1, Pharmacy Practice Residency at Jackson Memorial Hospital in Miami, Florida. After that, I did a specialized residency, which was focused in infectious diseases, and this was also at Jackson Memorial in Miami, Florida. With these new skills, I was able to obtain my job that I have now as faculty. As an assistant professor, the three core areas for me are teaching, research, and service. And when it comes to teaching, I teach students and residents and other healthcare professionals. In the classroom, I teach lectures to large class settings that are broadcast to Puerto Rico and Palm Beach, with the main campus being in Davie or Fort Lauderdale. At my practice site, I have students come on rotation with me during their final year of pharmacy school, where I teach them about infectious disease pharmacotherapy. Also, they have a chance to interact with the healthcare providers and team here, and we talk about patient cases, we review drug utilization, and do many other activities to enhance their learning. Also, I provide continuing education to pharmacists, pharmacy technicians, and other healthcare professionals in various venues, whether it be at a local meeting or a local gathering or national meeting or whatnot. In terms of research, research is pretty dynamic. At Jackson, I'm able to participate in research that is specific to patient populations with infectious diseases. So I can do retrospective research, looking at different charts from a patient's history. I'm also involved in research that deals with students teaching and learning at the College of Pharmacy. I involve pharmacy students in my research and participating in the research, whether it be for literature review or other things. I'm also able to work with physicians, pharmacists, administrators, statisticians, and others on research projects. For me, I try to publish research in healthcare-related journals, but also participate in meetings at the local, national, and international levels when possible. In terms of service, service is, a lot of it for me is on committees. So I've served on the admissions committee, the scholarship committee, the curriculum committee, and many others at the university. I'm also the director of the Advanced Clinical Experience Program, or ACE program. That's a collaboration between Nova Southeastern University College of Pharmacy and Jackson Memorial Hospital. This is a program that I've been able to offer to 6 students, and they have to apply for the program. And during their first 6 APPE rotations, or during the first 6 months of their last year of pharmacy school, they spend 6 months here at Jackson Memorial Hospital, rounding with pharmacists and getting a high-level exposure to clinical pharmacy. There's also miscellaneous components to that program as well. When it comes to an average day, if I had to describe one, really, I would come in about 8 o'clock in the morning or a little earlier and end up meeting with students between 8 and 8:30. We usually meet for an hour to talk about a topic such as urinary tract infections or a different antibiotic class. After that, we'd go to rounds. During rounds is a time when you sit with physicians and you talk about the different patients that they're following. I round with infectious disease physicians, so we only talk about patients with infections. So during rounds, I'm listening to what's going on with the patients, what the plans are, and I try to help in enhancing any of their therapies. So switching from intravenous to oral therapy, helping them get out of the hospital sooner, decreasing costs, increasing efficacy, anything like that is what I'm trying to do. Rounds usually get done around 11 or 12, and by that time I go and have some lunch. Afterwards, I'll meet with the students again to touch base and see how things are going, give them assignments to have them answer drug information questions or things of that nature. I also usually have meetings in the afternoon, so I might have to meet with other pharmacists to discuss ongoing research projects or service-related activities. And then I have a lot of emails that I have to catch up on between the university and the hospital. That's typically an average day, which is quite busy, and it's very fun, in my opinion, but it's also a challenge. In terms of advice for future pharmacy students or current pharmacy students that are interested in becoming an assistant professor within the Department of Pharmacy Practice, number one, I'd recommend that you look into postgraduate training. So whether that be a postgraduate year 1 residency or a PGY2, a second year residency that specializes in a different area like infectious diseases, transplant oncology, or etc. You can look into different fellowship programs, which are typically 2 years in length. And you can also get advanced degrees such as a PhD in statistics or a Master's of Business Administration or other things of that nature. So one of the main reasons to consider doing postgraduate training after receiving your doctorate of pharmacy is because most academic positions require specialization or advanced training. Many colleges of pharmacy would consider an applicant much more highly if they have qualifications in statistics, clinical research, clinical pharmacy activities within an inpatient or outpatient setting, or other specializations and training of that sort. Additionally, I would highly recommend that you talk to all the different pharmacists that you meet during your academic career. Ask them how they got to where they are today and what they wish they knew when they were in your shoes. We sure can learn a lot from each other if we just ask. And also networking is really big. So if you're able to go to a meeting, don't be afraid to strike up a conversation with someone, and that's the best way to learn is through others' experiences.